up to where I don't have the doorbell ring when people come in. So I think we'll go ahead and get started because I want to be respectful of everyone's time. So it's my pleasure to welcome our speaker today. Do you go by Janie?
Yes.
Janie Fielder. And she is a medical oncology nurse practitioner with Natera, and will be speaking to us today about personalized medicine and how it relates to your personal patient care. And we're going to save questions for the end, but if you would like to put questions in the chat as well, we will go over each of your questions as time allows. And I'm going to stop my share screen and let Ms. Fielder share hers. And go ahead whenever you're ready. Also, the majority, just so you know, the majority of our audience is metastatic breast cancer patients. We may have a few patients that are early stage. I myself am a stage 3 estrogen positive breast cancer survivor, and I started the Twisted Pink Foundation to raise more funding and awareness for metastatic breast cancer. So welcome everybody that's on the call, and we're glad that you're here today.
Awesome. Thank you. It is truly a privilege to be here today. I also want to mention Dana, who I see is on the call. She had a couple of different other obligations today, but she is available, not on video because I think she's in her car or something. So, but I want to make sure you know that Dana, your local representative, is available. So thank you so much for asking me today. And I'm going to talk to you about two personalized cancer assays that we have at Natera. The first is Signatera and the second is Empower. So let's just kind of start by talking about who is Natera. So Natera, we say DNA is in our blood. Natera started out as looking at cell-free DNA in non-invasive prenatal testing. You may have heard about the test Panorama. You may have even had the test if you were pregnant. And so it looks for cell-free DNA for chromosomal abnormalities with the fetus. And then we also have a cell-free DNA test in organ health, looking for donor-derived cell-free DNA for potential organ rejection. And so we also now have testing assays, Signatera and Empower in oncology. And so we have been dedicated to women and organ health and now oncology for numerous years. We have a lot of data in these areas, but today I'm going to focus on Signatera and Empower. And so these are probably questions I'm guessing you all have asked your providers and had in your head every single day in your journey. How do I know if my treatment is working? And how do I know if my cancer is coming back? And so before we talk specifically about how to answer those questions, I want to talk to you about what is molecular residual disease. So molecular residual disease, or MRD, you may hear it referred to, is the presence of very small traces of cancer in the blood, such as circulating tumor DNA, which you may hear referred to as ctDNA. And that is how I will refer to it so that I don't have to say the whole term the rest of this presentation. So what exactly is ctDNA? So ctDNA is small pieces from the tumor cells. So when tumor cells, cancer cells break down, they release the DNA, which, as we all know, our DNA is rich with lots of information about us. And so that is what we are looking for when we build the Signatera test. So you can see there's a lot of things floating around in your blood, but ctDNA is a great biomarker to use in cancer because it comes straight from the tumor and it has a very short half-life. So when you have a blood draw for Signatera, the half-life of ctDNA is less than 2 hours. So we know that it's a real near-time biomarker that we can use to detect what's going on in your blood with your cancer. So the Signatera approach is a little bit different. We are looking for a needle in a haystack because the average ctDNA fragment is very, very small. So we know we have lots of mutations floating around in our blood system now, and some of them are from germline or hereditary. Some are from, if you have cancer, a tumor, and then some just occur because when cells break down and they divide, they just sometimes don't do it all correctly, and so you have mutations. So we are a little bit different in how we develop Signatera in that we are looking for those mutations that are very specific to your cancer's tumor. So how do we do this? So we start with a one-time analysis of blood and tissue. So this can be tissue from the biopsy. It can be from your surgical specimen. If you have a confirmed metastatic site that they've done a biopsy, we can also use that tissue. So we take tissue and we take blood, and we do whole exome sequencing on both of those because we want to filter out the mutations that I mentioned earlier, the chip and germline mutations that are in your body. We want just the mutations that are specific to your cancer. So by doing this evaluation, we're able to filter out the noise and just look for clonal mutations. So we want to know the mutations that appeared early in the evolution of your cancer, and they persist throughout, but they're not subject to treatment. And so we use that, and we develop then a test for each patient based on that. So every subsequent blood draw that you have, we will use your assay. It's not a panel used on everyone else. It is a panel built specifically for you. And then in the last picture on the right, you can see an example then of the report that your provider will receive, which lists what's going on, what the results are from your Signatera test. It will list a positive and a negative, and it will also list a value in mean tumor molecules per ml. So you can see if it's 0, if it's increasing or decreasing. So that provides your provider with information about your process. And this is an example of a patient journey. So you can see on the very far left, many of you that have been through this journey, it started with maybe you felt a lump, or maybe you had a mammogram and something was detected, and then you had a biopsy and you had diagnosis. And you may have had several different tests that happened at that time to give your provider information, and then you ask questions and have conversations about what is the plan next. And so some patients qualify for hereditary cancer testing at this point. So we know that patients that have right now in the guidelines, if you are diagnosed with cancer at an age of less than 50, or you are diagnosed with triple negative breast cancer, then you would qualify for hereditary or germline cancer testing. And Empower is the assay that we have that looks for those germline mutations. We have a stat panel that looks for BRCA1/2. That is information that will help your provider and you and potential family members if you have a germline mutation. And so then as you move further down, there's initial intervention. And for some, that may have been neoadjuvant chemotherapy used to shrink your tumor. Some go straight to surgery at this point in time. So whatever the intervention is, Signatera can play a role in wherever you are, if they're finding any disease left in your body at a molecular level, as I earlier described. So we know that scans cannot find molecular residual disease because remember, there's such tiny fragments in your body. So Signatera can also be used at the post-surgical time point to detect if you have any residual traces of cancer after surgery to aid you and your provider in talking about next steps. And so then following surgery for the next step, for some, it might be chemotherapy, might be endocrine therapy, and whatever, and some may move right on to surveillance. But if you are receiving treatment, Signatera can help monitor if the treatment that you are receiving is working. So in other words, that one question that I had at the beginning of how do I know if my cancer is responding to treatment? So when you think about treatment monitoring, that would be in the neoadjuvant space. That could be in the adjuvant time period after surgery, but also for the case of some of you, if you are receiving treatment now or you are on immunotherapy in the metastatic cancer setting, then Signatera can also be used to monitor your response to treatment. So when you think about it, let's go back to then after surgery and completion of your treatment, then you may be deemed to be in surveillance. And so that brings up another question of how do I know if my cancer is returning? So Signatera can be used to monitor any residual traces of your cancer. And we have in all of our studies noted that Signatera will be positive up to several months prior to seeing metastatic recurrence on imaging. So it can assist you and your provider in making decisions again about next steps. So it all comes down to being able to catch the cancer before it spreads, and treatment options are limited. So we are very excited that this year we received Medicare coverage for breast cancer, stage 2B and above. In breast cancer, we already had Medicare coverage in immunotherapy monitoring for treatment response. Once again, we have numerous individuals at Signatera that can talk with you about billing, about support, about financial access programs. If your provider orders Signatera and you can't go into the office or your provider is not close by, we also have mobile phlebotomy that is available at no extra charge. And so just to kind of look at what we've talked about so far. Signatera is custom built for you based on the mutational signature of your tumor. It's been studied across multiple different solid tumor types. We're talking about breast cancer today, but also ovarian cancer, colorectal cancer, muscle-invasive bladder cancer. So we have a lot of data in other areas. It can be used alongside other biomarkers that your provider orders and imaging. It can be used to determine if there's signs of cancer left in your body after treatment, whether additional treatment is working, and if your cancer is recurring. So all along your cancer journey, this can assist you. And so I wanted to provide you with a link to the website where we have numerous pieces of information available. We also have patient videos listed out on here where there are actual patients talking about their cancer journey in breast cancer and other cancers and how Signatera helped them along the way. You can speak with your provider, obviously, and then we do have an email that you can reach out to with any questions. So I will stop there, Caroline, and see if there are any questions I can answer. I think you're on mute.
Sorry about that. There is a comment and question. So Janice Cowden states, thank you, Caroline and Janie, for providing this informative webinar. Nearly 2 years ago, I attempted to have a Signatera test done. Unfortunately, insufficient tumor tissue remains. It was mentioned that Natera was working on a tumor agnostic ctDNA assay for MRD. Can you provide an update on the progress? I was diagnosed stage 4 triple negative breast cancer in 2016. No evidence of disease for nearly 7 years, and hoping to find a tumor agnostic test as an additional surveillance monitoring option in combination with imaging.
So we are working on a tumor naive option. It's not available yet. So I'm sorry, it's not available at this point in time. And I don't really have an estimate. But I guess the other question I would ask is, is there any tumor available from like a metastatic site, a biopsy, a surgical site? If there's any of those available, we can try.
Hi, sorry. Um, that was the metastatic site
Okay.
biopsy.
Okay.
And it's been spread a little thin over the years with, involved in the NBC project, all kinds of other, second opinions and so forth. And so when it was submitted to Natera, I got a call stating that there was just insufficient tumor tissue left. So at the time they did, I had a great conversation with somebody at Natera. I can't remember who it was, but they said, we are working on a tumor agnostic assay. And I just think that it would be great to have something that's available for those of us who either are far out and no longer have tissue banked, or those of us who are fortunate enough to have no evidence of disease for many years and have nothing new to biopsy.
Yeah,
It's a
absolutely.
good problem to have.
We believe the same thing. So yes, we are working on it. I'm not involved in that, but I hear talk of it from time to time. So yes, I know it's in process.
Hi, this
Thank
is Dana.
you.
I'm the sales rep in Louisville, and I work along with Caroline and Janie. What we've heard on our end is maybe 2024 to have some type of release for liquid only. Fingers
Thank you. That's
crossed.
promising.
Any other questions? So I do have one. So, I've had this conversation with Dana as well. So she knows my story, but I am 10 years out from my diagnosis, still on an aromatase inhibitor. And I've had conversations with my physician about doing the Signatera test just to rule out any type of, number one, to know what my risk of recurrence is. And my physician, my oncologist, is very hesitant to do that test because he has stated that there are no treatment options. And this question actually came up at a medical conference, and the majority of the oncologists agreed that you should not do the test in my situation, because there's no treatment available and it would cause more anxiety than not. My position is that I'm already having anxiety, so I don't see that it's causing more, but that's from a patient perspective and not a physician. So do you all do any kind of educating with physicians on that topic? And yeah, I guess that's it.
So absolutely. We're happy to talk with any provider. You probably won't be surprised when I say that frequently Dana or I and other people get questions from providers if I have a patient that came in and talked to me about this and really wants the test. And so, help me understand. We frequently hear from providers of, what do I do if it's positive? And so in the breast cancer space, we do have 2 large trials going on right now, looking at patients that are ER positive, and you have to be positive with Signatera to get enrolled in the trial. And it randomizes each study to 2 different treatment regimens to help answer that question. What do I do if this patient becomes positive? Because today we don't have data to say exactly what you.
Oh, sorry. Go ahead. I muted you and I meant to mute myself.
Can you hear me?
Yeah, sorry.
Okay. I lost my train of thought. So I think what providers that use the test say is that they look at their patients differently. So would you want to follow them more frequently with Signatera? Would you want to do different types of imaging? If you're not metastatic, where, for example, if you have lobular breast cancer, we know that frequently goes to the bone. So, and if you're asymptomatic, then where would you look for that? So they look at their patients differently and how they're being monitored. We all know that the recommendations to surveil breast cancer patients is to, generally speaking, is to come in once a year, have an exam, and imaging is only done if you're symptomatic. So there really, in breast cancer, is a lack of tools for the patients and the providers to be able to monitor your cancer and the chance of coming back.
Yes. Which is very unfortunate. It doesn't give you a good, peace of mind, but that's not your issue to tackle. I guess it's advocacy.
Well, as how we're trying to tackle that is with providing another tool, and the provider and patient's tool belt to be able to monitor and answer that question. How do I know if my cancer is coming back?
Yeah, thank you.
Does that make sense?
Of course. Okay.
Anything else? Any stories you want to share, or Dana, anything you want to add?
Yeah, I just want to add that, we obviously having the patients, have that discussion with their physician is very, very powerful. And Caroline, you and I have talked on numerous occasions about that. There's no more treatment options. So why do you need this test? Well, you all know why you would want to test, and you all would know, if you have a positive, how that makes you feel and what you would want to do. There are things that can be done for metastatic breast cancer patients if you have a positive Signatera. First of all, you wouldn't act on the one result. You probably would have a repeat. You may have additional testing done. So that's one option. But what if it's negative? This is something that you can have, you continuing on, throughout your life. And maybe it's just a reassurance that, there's not any real great biomarkers out there for breast cancer. So this could be like what patients with colorectal cancer get their biomarkers, CEA. This could be just like, ovarian, CA19. I mean, these are the types of tests that are being ongoing for those types of patients. So Signatera could be, a biomarker that you just get checked, and, it's negative means you all can just take a deep breath and go about your life the way you want. But that's, if you have physicians that are just adamant they don't want to, test or use this test, well, that's a decision you have to make at that point on, do I want to continue with this provider because I want this test, but I want to, be seen, obviously, or can this provider see my point of view? And that's, I had those conversations every day with providers, about what do you think your patients want to know the most? And after the active treatment, and these are very common conversations.
Thank you. Okay, we have another thing in the chat. Let me see if I can pull that up. Okay. Thank you. It's from Veronica. Thank you. I now have more to discuss with my oncologist. I had invasive lobular and on a trial drug, so I'm always anxious to see if the drug is working or not. Someone I know had the test done and is waiting for results. Can you touch on the cost or discuss the cost of the test? Is that dependent on insurance?
Well, I'll address that. So Medicare approves breast cancer, regardless of stage, for a neoadjuvant setting, the adjuvant setting, surveillance, immunotherapy, and just continued, quite honestly, survivorship. So Medicare, it's covered. For commercial insurances, it is a fairly new test, and things take a while to get approved or into standards of care as it comes to, the clinical side of things, as well as the commercial payer side of things. So at this point, we will bill insurances. So we do collect the information on the insurance for the patients. But majority of the time, the insurance denies our test. But what that means is when it is denied, we do not bill the patients. So at this point, if you had, let's, for example, have Humana and you had a Signatera test or had, you know, a Signatera test every 3 months or every 6 months or every year, it may come back as a denial from Humana, but you would not get a bill from Natera. So we're working for coverage. That's something that all these testing companies do. But at this point, that's where we are. So it's kind of a nice, it's a nice thing. And, you know, if you're thinking about the patient standpoint is, you know, it won't, you don't have to worry about your deductible or your copays or anything like that. If it's denied straight out, then you will not get a bill. Hope that answers your question.
And is that the same all across the country or just in Kentucky? Because I
It
want to make
is.
sure. Okay, good.
It is the same. Now there are, fortunately, we've had some great successes when we're moving for more and more successes. And I don't know the exact payers and exact states, but I can get that information if somebody's interested in knowing specifically. And I can get CPT codes out, Caroline, if you want to, if that was something somebody's interested in, I can send those to you for them to check their insurance. But the majority, you know, I would say 98% of the time, my conversation is to providers or to patients wanting to know what the cost is literally you're not going to have a bill from this because we're not covered by insurance and we do not balance bill. And if your insurance does cover it, that's awesome. We appreciate that. And of course, your copays and deductibles would apply just like any other test. Any additional questions on that?
It doesn't look like it. And the chat is empty. So thank you all so much for, oh, she says, yes, thank you. Okay, so thank you all so much for being with us today. We did record the video and we'll put it up on the Twisted Pink website for anyone that wasn't, well, we'll email it out to everyone that registered that wasn't able to make the call. And then it'll also be on our website if you want to go back and if you don't remember something, you can go back and watch. If you have additional questions, how should we contact you, Dana? Or do you want to put your email in the chat or just go through me?
I just put my phone number and email in the chat.
Okay, great. Thank you.
And if anyone has really high level scientific questions, I will make sure that I will forward you all Janie's information too.
Happy to help.
Well, thanks, Caroline, for inviting
Thank
us.
you.
We appreciate
Yes.
it. And
You're so
good luck,
welcome.
everyone.
Thank you.
Have a good day.